Necrotizing enterocolitis is a severe intestinal disorder characterized by inflammatory processes and ischemic necrosis of some parts of the intestines. This disorder could affect the terminal ileum; however, the colon is most commonly affected. Necrotizing enterocolitis has a multifactorial pathological process, which we shall come to terms with pretty soon. Preterm infants are commonly afflicted by this disorder due to their immature gastrointestinal tracts, characterized by diminished intercellular junction integrity, as well as reduced mucosal barrier. These two factors, together with others, would enhance dysbiosis of the normal intestinal microbiome, elevation of pathogenic bacterial growth, exaggerated immune system response, release of host cytokines and chemokines, which would now lead to tissue injury and eventually necrosis, hence the name necrotizing enterocolitis. In the case of term infants, however, an underlying condition that may be adversely affecting intestinal perfusion could be the reason. Risk factors that could lead to necrotizing enterocolitis include gestational age less than 32 weeks, low birth weight, meaning less than 2 kg at birth. Dysbiosis contributing interventions such as use of antibiotics, acid-reducing agents, feeding bovine milk formula, etc. Therefore, human milk is recommended due to its ability to promote commensal bacterial growth and support mucosal integrity. Other risk factors for necrotizing enterocolitis include infections, especially when gas-forming organisms are involved. In the case of term infants, the risk factors would include fetal growth restriction, perinatal hypoxia, congenital heart disease, gastrointestinal disorders, and sepsis. Complications of necrotizing enterocolitis include bowel perforation, ileus, septic shock, metabolic acidosis, coagulopathy, and respiratory failure. Specific surgical complications include strictures and short bowel syndrome. Some other complications include increased risk of neurodevelopmental disorders, the presence of neurological changes, and subsequent neurodevelopmental impairment in patients with a history of necrotizing enterocolitis is well established. The systemic inflammatory response triggered by necrotizing enterocolitis may be mediated via bacterial products and cytokines released during intestinal injury. This, combined with the associated hypotension that is part of the systemic inflammatory response, results in a signal traversing the gut-brain barrier, which would then cause well-documented white matter injury. Other notable changes in the brain include alterations of the brain parenchyma. Decreased head circumference is also another complication that could be realized from this disease, as well as corresponding decreased volumes in the total brain matter. This stunted head growth and altered brain parenchyma in early infancy are detrimental to later cognitive outcomes and result in downstream neurodevelopmental impairment, including a higher incidence of cerebral palsy, impaired motor function, visual and hearing impairment, as well as cognitive deficits. Necrotizing enterocolitis is characterized by a pretty high mortality rate. Signs and symptoms of necrotizing enterocolitis include abrupt feeding tolerance change, abdominal distension and tenderness, increased gastric residuals, bilious vomiting and bilious drainage from enteral feeding tubes, as well as hematochezia. Non-specific findings include temperature instability, lethargy, as well as apnea. Diagnostic imaging would normally include abdominal radiography and ultrasound, and these may reveal nematosis intestinalis, as well as pneumoperitoneum. In some cases, there could be hepatobiliary gas. Laboratory investigations may reveal positive blood culture, decreased platelet counts, decreased red blood cell count, evidence of disseminated intravascular coagulopathy, as well as increased serum lactate. Treatment of necrotizing enterocolitis involves empirical antimicrobial therapy, exploratory laparotomy and bowel resection, as well as primary peritoneal drainage, which would reduce the intra-abdominal pressure. Thanks for watching.